subscribe now and press the bell icon. Never miss an update.
Welcome to Health Live at Seniors today. We are delighted to have here with us Dr. Behram Pardiwalla, who is Director of Internal Medicine at the Kolkata Hospitals. And he's going to be speaking with us on hypertension for seniors. As you are aware, the World Hypertension Day was observed on May 17th, and we thought it would be a good idea to have one of the noted internal medicine specialists to talk about it. Now, Dr. Pardiwalla has schooled in Martiniere Kolkata, and after that, he did his undergraduate and postgraduate degrees from the St. GS Medical College and the KEM Hospital in Mumbai. Those of you who are from Mumbai know that if you've got into GS Medical College or KEM Hospital, that you are one of the top rankers in the country. So Dr. Pardiwalla was awarded the Lord Sandhurst Gold Medal and the Vasant Khanolkar Prize, and was also the recipient of the Bombay University Merit Scholarship for Postgraduate Studies, and was voted the best resident at the KEM Hospital. He is also a postgraduate teacher in medicine for the GNB examination at the Martiniere Hospital, and also unit head at the Parsi General Hospitals. Dr. Pardiwalla is regional faculty for the International Diabetic Federation course in diabetes. He is life member Association of Physicians in Mumbai. He is founder, life member, Indian Society of Critical Care, and committee member of the Indian Burns Research Society. Welcome to Health Live at Seniors today, Dr. Pardiwalla. Delighted that you are here.
Thank you.
So, Doctor, would you like to say a few opening remarks on the case of hypertension for seniors?
Sure. At the outset, thank you very much for inviting me, and my apologies again for being late. As you know, 2 days ago, we celebrated World Hypertension Day, which is celebrated over the last few years. Hypertension is known as a silent killer because it works in the background. It can affect your brain, give you strokes. It can affect your heart, give you a heart attack or what we call a myocardial infarction. It can be acting on your kidneys, giving rise to chronic renal failure. It can cause a multitude of symptoms. There is a saying in blood pressure, in hypertension management, that only 50% of the people know that they have blood pressure. Out of the 50% who know that they have blood pressure, only 50% are taking treatment for blood pressure. Out of the 50% who are taking treatment for blood pressure, only 50% of them are under control. So that means hardly 5 to 7.5% of the people in actuality are under control for blood pressure. A few years ago, a leading pharmaceutical company carried out a survey in the major metropolises of India. These included, I think, Delhi, Chennai, Mumbai, Kolkata. You will be shocked to know what we found as far as Mumbai was concerned. The study was done by checking any patient who entered the GP's clinic, general practitioner, your family doctor. So you may have got to him. We selected 2 days. And on those 2 days, any patient going in, whether he went in for fever, he went in to have an injection taken, he went in for diarrhea, he went in for anything, he went in to show his reports, his blood pressure was taken. And this was all across Mumbai, all across India in the major urban centers. And you will be shocked. 60% of the patients walking into the OPD had high blood pressure. And out of the 60%, 80% did not know that they had high blood pressure. So you can imagine the extent of blood pressure which is prevalent. Long ago, when I was at KEM Hospital, the F South Ward conducted a survey, and they found that 20% of Bombay's adult population in the F South Ward had hypertension. And this was 30 years, 40 years ago. So you can imagine what the scenario is today. Now, with these opening remarks, I'm open to any questions, any queries, etc., which any of your audience may have.
Thank you very much, Doctor. Quite a few questions have come in already, but I need to ask you this question, which I remember asking somebody else also in the past. One of the things that we've seen in the recent years and especially in cities like Mumbai, is the absence of uh, general practitioners. You spoke about general practitioners, but uh, there are hardly any general practitioners around. For instance, I may have had a general practitioners for a good amount of time, but the last 10, 15 years, I've not had a family doctor, so to say. And that's because, there aren't too many around.
That's true. What happens is that the doctors who pass out after MBBS, at my time, almost 30% went into general practice, 70% went into specialization. And out of the 70% who went into specialization, only 10% remain in India, 60% are in the US and other countries of the world. So you can imagine. Now it's changing. I think some people are becoming, you see the fathers who is a GP encouraging his son to take up general practice. The trend is slowly changing. So if you go through Lal Bagh, Parel, any of these areas, you will definitely find a general practitioner. Unfortunately, I don't mean it to be demeaning, but not many MBBS doctors take up general practice. General practice is taken up by the BAMS or the homeopaths. And that is why sometimes there's a lack of, unfortunately, quality.
So in that event, what does one do? One goes to an internal medicine specialist like
yourself? So basically you come to a person like me, who's an internal medicine specialist. That is, so often, the patient says, the doctor, we don't have a GP, you are our GP. And I say, okay, so I'm your GP. Yeah, that's true. They come to us. Because, when you touch hospital for the first time, it is the internal medicine specialist who will be your point of contact. And it is now in most of the big hospitals need to have internal medicine specialists involved in most of the cases. Because in this era of super specialization, what happens is that the heart guy will only look after the heart, the lung will only look after the lungs, the kidney guy will only look after the kidney. So you need a guy who oversees the whole thing, who points out to the heart guy, this drug is bad for the kidney, you can't be doing this. Points out to the kidney guy, this is bad for the heart, you can't be doing that. So you need that sort of a guy who connects all the dots and, crosses the T's.
Right. And, your affiliations of various associations, burns and diabetes, etc., just indicates the need.
Widespread, exactly.
The widespread that is there. Okay, doctor, I'll just get to the questions right away. We have Bharat Mehta, who's 66. His question is, how does one control hypertension as we have a family history of heart ailment?
Fine. So the first thing in controlling hypertension, there are two ways that you need to do it. One is lifestyle measures. And by lifestyle measures, I mean, one, a healthy diet. I'll come to that. A healthy diet. If you're smoking, stop smoking. Alcohol only in moderation, which means 3 to 4 units a week. Regular exercise means about 150 minutes of exercise, walking, whatever it is, per week. Now, coming to the diet specificity. Diet should be ideally the Mediterranean diet or the DASH diet, as we call it. Diet habits to reduce hypertension. In that, you can have dairy, but low-fat dairy. You can have non-vegetarian food, which will be lean meat, such as fish and chicken. Oilier the fish, the better it is, such as mackerel, herring, etc. No red meats, no processed meats, and lots of vegetables and fruits. More the multicolor of the fruit and vegetables, the better it is for you. That is the classical Mediterranean diet.
Doctor, what else?
That is the lifestyle part. The other part is medication. Medication will depend upon what your doctor gives you, looking at your comorbid conditions. Do you have a heart problem? Do you have anything wrong with your brain? Do you have anything wrong with your kidneys? He will decide what is to be given to you. You must understand that the latest definition of hypertension has changed, and we are now becoming very strict about hypertension. We aim at a blood pressure of 130/80, regardless of the age, right? It was earlier much more lenient, 140/90. In fact, I remember 10, 15 years ago, it used to be that for every 10 years of age, you can add 10 millimeters to the systolic blood pressure. That is all gone now. It's 130/80. Another very good measure to resolve blood pressure is meditation. Yoga and meditation play a huge role in reducing blood pressure.
Right. So basically, it is 130/80. Anything above or below is abnormal.
Anything below is desirable. Anything above that is abnormal.
Right. Thank you. Doctor, there is a question from C.A. Shah. For 64-year-old woman with no other medical problems, can 140/90 be considered normal? What should be the ideal reading? What if it sometimes goes to 163/78?
So 140/90 in the present criteria is abnormal. Again, I emphasize you need to aim at 130/80. That is essential, because even at 140/90, you have a residual risk of hypertension, meaning it can affect your kidneys, it can affect your eyes, your brain, etc. Therefore, 130/80 is what you aim at.
Right, thank you. We have a question from Katie Daganchi. Doctor, I have the white coat syndrome, and when I need to see any doctor, my BP and pulse rate go up since very many years, and it becomes normal later. How do I overcome this problem? I'm 71 years old, and blood pressure is 140/90.
Well, I think from the name, it means, I think it's a lady, ma'am. If you are indeed a lady, then avoid going to handsome doctors. I'm joking. But white coat hypertension is really, it's a known clinical entity where when you go to a doctor, your pressure goes up, and when you go home, your pressure becomes normal. Normally, we try and relax the patient when we see white coat hypertension. If we see that the patient has repeated white coat hypertension, even after taking the blood pressure 3 times in a visit, then we subject him to what is known as an ambulatory blood pressure monitoring, in which we put a blood pressure measuring device on him and let him go home. And we observe the blood pressure behavior over 24 hours, and we record it on a computer and see the trend. That gives us a good idea whether he is actually a hypertensive or not. If he is actually a hypertensive, he takes treatment. If it's only hypertension which comes when you see the doctor, under those circumstances, we need to counsel him, help him do some exercise, meditation, which would help.
Thank you. We have a question from Mr. Rajendra Mirajkar, who says, who asks, what has BP got to do with blur seen in the eye vision sometimes?
What has BP got to do with blurring in the vision?
Yeah, blurring in the vision.
Fine. So as I mentioned to you, one of the sites at which blood pressure can act is in the eyes. You have arterial supply going to the retina. And when you have high blood pressure, sometimes the blood supply can go down and you can get a blurring of the vision. Sometimes with very high blood pressures, you can even get a clot going into the retinal artery when you can temporarily become blind. So these are the reasons why you sometimes see abnormal vision when you have got severe hypertension.
Right. We have a question from Kamlesh Bajpai, who asks, is beta blocker good to use in high BP? Is it safe as it slows down the heart rate?
Beta blockers are one of the armamentarium that we use in the control of blood pressure. It depends upon the sort of blood pressure that you have. The older beta blockers, we do not use them now because they do not reduce the central aortic root pressure, meaning the pressure which is there in the big artery of the heart over here, they do not reduce that. But the new beta blockers, which reduce the central aortic root pressure, they are definitely useful in the treatment of hypertension.
Right. Thank you. We have a question from Rajendra Nambajkar again. Is numb feeling in the fist and below the feet anything to do with the BP?
There could be lots of causes of this numb feeling, especially below the wrist. The commonest reason why you get this numb feeling below your wrist is what we call a carpal tunnel syndrome, where at the wrist, your nerve is pinched. The median nerve is pinched. This can easily be found out if you do a nerve conduction study. If you are obese or you have a low thyroid where you have a little fatty tissue, these conditions occur. The other thing is, if it's only on one side, it could suggest that there's less blood supply going on that side in the brain, which could also be related to high blood pressure.
Right. We have a question from Nayan Nair, who's 78, and he says losing sleep for he loses sleep in the night for more than 2 years. His question is, I'm 78 old year, senior citizen, have serious issues of losing sleep at night for 2 hours. He sent us a mail today, which I haven't received. Is this happening due to hypertension? He's from Trivandrum.
He doesn't get sleep at night, is it?
Yeah.
Well, you see, as you grow older, towards about 1 to 3 is a period when you tend to wake up. Now you need to, in these sort of circumstances, this is known as insomnia. And you need to have what is called sleep hygiene. In the sense, before you go to sleep, make sure that you haven't had a heavy meal, make sure that you haven't had alcohol, make sure that you had a warm bath, and clear your thoughts. Don't think of anything, not what has happened today, not what you're going to do tomorrow. Keep your mind a blank. That is a sort of sleep hygiene that you should practice. If you do that, you will invariably be able to sleep peacefully.
Right. So, Nair, I hope this has answered your question. Does, from Rajendra Mirajkar once again, does pudina chutney help in BP?
It's a green chutney. Pudina is green. Pudina is an antioxidant in the sense it increases native oxygen species in the blood. From that point of view, yes, it could help. Remember, every little thing tends to help. It's not that if you take Pudina chutney, your blood pressure is going to go away. You will need to take your blood pressure medication. You will need to have your lifestyle modification. You need to have your dietary restriction. Adding Pudina chutney would be the icing on the cake.
But of course, with chutneys, if you put a lot of salt in it, etc.,
then it's useless.
Negates it.
Then it's useless. It negates the whole thing. Because you must restrict the salt to less than 4 grams in 24 hours. That is in your DASH diet.
That's the question that we have right now it's exceedingly difficult. The question says to keep it under control to just 4 or 5 grams. How does one manage to have such little salt? And what about the low salt options?
Basically, yeah, you have low salt options. These are the potassium salts. You can use these potassium salts. Remember, you cannot put potassium salt whilst cooking, because if you use the potassium salt whilst cooking, your food will become bitter. You have to use the potassium salt after the food has been cooked. It is an acquired taste. It tastes it leaves a little bit of a bitter aftertaste. The other way that you can cheat yourself is by adding lime, nimbu. If you add lime to the food, it will make it different. But remember, what is more important is the hidden sources of salt. Your bread contains salt. Your biscuits contain salt. Any preserved food contains salt. Cheese contains salt. So you have to be careful of these hidden sources of salt.
Right. Doctor, there's a question which has come in. We normally don't recommend doing this, but what are the options of potassium salt is what this person has asked.
Whatever commercial potassium salt is available in the market, you could use it.
But use it only
after you cook, not during the cooking process. Heat will make the potassium come out and it will taste very bitter.
Right. Doctor, you mentioned about 150 minutes per week. But is there anything of you can't do 150 minutes all at a time, right? You need
you can't do that. So on a reasonable thing would be to do about, say, 25 minutes 6 days a week, right? Or you do 30 minutes on 2 days and split the other between the 4. But the idea is that you should have 150 minutes of a walk, not even a brisk walk, a reasonable walk.
Right. Doctor, there's some question that has come in on walking. Is that, do you recommend that to take one of those devices that count your steps? And is the Apple Watch, which has an ECG, is that an appropriate, an effective measure for checking your heart movement?
Really, look, the Apple Watch gives you a very crude ECG tracing. The question is, what are you going to be doing with the ECG tracing unless you're a doctor? So that is useless from my point of view. All the watches, most of the watches which are digital in nature count your steps. They more or less count your heart rate. Most of them have, in fact, some of your phones also have a built-in sensor for measuring oxygen concentration, your heart rate, and everything. So you could use them. But remember, you don't have to go by that. You can take the satisfaction of saying, oh, I walked 3,000 steps today. That's about all. But you should aim that you get good exercise and healthy exercise. Why I say that? Because with exercise, your feel-good hormone, known as hormones, get secreted. That is why after exercise, you feel good, you feel energetic. That is what is important.
Doctor, this is the question that we've had in the past, and I would like to raise this here because we are looking at BP, hypertension. Are electronic blood pressure meters reliable? Or is it a good idea to have the good old, BP measuring tools?
The mercury manometer has been banned by the WHO because mercury is hazardous. And you do not find mercury manometers, they are not available now. They've been banned. Secondly, you can use digital blood pressure machines, get certified machines. They are machines which have been certified by the British Hypertension Society, by ISI. Those are the good machines. And you need to just tie them properly and use them properly. The cuff should be the correct size. The cuff should be placed properly on the arm, and the level of the machine should be at the level of the heart. If you can manage these three things, your readings will be absolutely correct.
Doctor, those three things that you've asked for are exceedingly difficult because these days people order these devices from the internet. And, for instance, I remember ordering it and I found that the cuff size was not right. So then, I had to look at options, etc.
That's right. So these are the two. When you order the device, make sure that it is certified. Is it BIS certified, Indian standard certified? Second, what is the cuff size they offer you? Adult, which size? That. And keeping it at the heart level is simple. You can lie down and keep it next to you. That's the heart level.
Right. Thank you. We have a question from Kunjubihari Trilokekar. Says, my wife, who's 77, generally has good health. We check our BP periodically, and she has been taking amlopin 5 mg to keep it under control. Of late, she's been having her diastolic pressure in the range of 86 to 92. She's been prescribed Almozest AM about a week back, but the lowest is still 86.
Almozest AM contains amlodipine 5 milligrams, and olmesartan, it could be 20, it could be 40. So you have, it's a misconception that blood pressure can be controlled by a single drug. Let me tell you, blood pressure is usually not controlled by a single drug. You need 2 or more drugs to control blood pressure. That is something that you must understand. I have been taking blood pressure medication since I was 30 years old. Patients always tell me, the doctor, at this age I started, doctor, at this age I take 2 tablets. And I always give my example. I said, look at me. I've been taking it since I was 30 years old. So, you cannot bury your head in the sand and say, no, I will not start it. They say that you get habituated to it. I can't counter question them. Do you have a bath every day? Do you eat food every day? Yes. Are you habituated to it? No. It's a lifestyle thing. You have to do it.
Right. Very well said, of course, doctor. And I hope you are, so what do you do, doctor? You have a fairly stressful schedule. You said you have, You had this at the age of 30. You are a Parsi, so you enjoy the good.
I enjoy the good things of life. You're
the
right.
good
Yes.
things of life. So how do you manage?
So
150.
you have to keep a calm demeanor. Don't let something hassle you. For example, I used to worry at a signal. Oh my God, look at this. I'm getting late. For example, today, I was at Sandhurst when the first call started coming in. Where are you? And I said, look, I'll be reaching. Give me a little time. Don't get hassled. You get hassled, your adrenaline starts going up. Your adrenaline starts going up, your blood pressure starts going up. Don't get hassled. That is the most important. And in your off time, relax. Do a little meditation. Give time to yourself. Let your body rest. Let your mind be at peace. Listen to some good music. Whatever you want.
Right. Absolutely. A lot of it, what you're saying is easier said than.
Yes, but I practice what I preach.
Absolutely. I can tell you that I was fairly relaxed, as people here would testify, when you hadn't come in, and I was wondering what to do, and I just kept people engaged. And of course, they were very helpful. They were very supportive. They said, "We'll wait for Dr. Pardiwala to come. No issues whatsoever."
Thank you. If I tell you my schedule, you'll be shocked. This morning, I get up at 6 usually. I got up at 6, I finished my breakfast, then I had some typing work, etc. to be done, some emails, etc. Finished that in the morning, got ready, went to the hospital, finished my inpatient round. As soon as I finished my inpatient round, the marketing people wanted me to do some photo shoots. So I did some photo shoots for them. I finished that and I started my outpatients. I finished the outpatients and I rushed to Hotel Heritage, where I was the chairperson for a medical meet. So I had a talk there. I finished that and I went to an old people's home where I'm on the trustees board, finished that. And now I'm in front of you. So that is the schedule that I have.
Absolutely. For people like yourself, it's, on all the doctors who come here, just think about, 100,000 salutes, because, and especially in the last 2.5 years, internal medicine specialists are perhaps the most in demand.
We are the most stressed. And let me tell you, my highest stress was during the COVID period. Demand for beds. You don't have a bed. What am I going to do? You have a patient, doctor, my father's saturation is 40. Doctor, my husband's saturation is 40. What do I do? Please get him anywhere. Get him in anywhere. What do I do? You tell me. That stress is too much to take. That is what sometimes keeps me awake at night. That did I do the wrong thing? Did I do the right thing? But when the beds are full, what do you do? It's tragic, but that is what it is. So in that, to keep a cool demeanor and to keep your mind cool is very tough.
And are you able to meditate? I'm sorry, I'm asking a few questions to doctor because we know that he has a exceedingly stressful life, and he's not exactly young, and so perhaps just from his experience we can get some tips about what it is. So
yes, of course I do. In the sense, what I meant by meditation was introspection.
Right.
So I in the morning when I get up, after I brush my teeth, very fortunately I'm in an area where I can see the sunrise and the sunset also. So I watch the sunrise. I see the birds flying. I look at everything. I think about all that has happened, all that could happen. I look at the good things as I sip my coffee. That's what you call by introspection. That settles you down, that cools you down. Any negative thoughts that come in my mind, I banish them. Because that is the only thing that is going to keep you going. And that is the most important.
Absolutely, Doctor. Great. So we have a few more questions. I'm going to put them here. Suresh Ghate, who's 70 years old. Mr. Ghate has had a BP issue. 2 weeks back, he underwent open heart valve replacement surgery. Besides healthy diet, what precautions to be taken to avoid hypertension, such as exercise, medication, etc.?
So I would suggest that if he's had open heart surgery, probably he's had a coronary artery bypass grafting. So it's now 2 weeks. So I think in the next 2 weeks or so, he should be able to walk around in the compound or in the house or wherever. He should start walking. He should be very careful with his diet. Avoid fatty food, especially saturated fats such as butter, etc. Use polyunsaturated fats, use olive oil, go on a DASH diet or what is called the Mediterranean diet. That would help considerably. And as I said, introspect, relax, please relax. We have found a lot of deaths in doctors nowadays. It's perhaps the stress that they're on. I have lost 4 classmates in the last 4 months. And I've lost some students. 2 or 3 of them were surgeons. I used to teach them when they were doing the MBBS. 2 of the surgeons died on the table while operating. So our life is very stressful, as you said. We have to learn to cool down. We have to learn to take a break. We have to look and turn away, deliberately turn away from the stress.
Absolutely. I guess that's the best thing for all of us over here. Doctor, we have a question from somebody who, Kunjvi Harit Lokekar, who had asked a question earlier. He says, your advice to control diastolic was to have more than one medicine. What do you recommend in addition to almost as AM? I'm not very sure whether we should answer
No,
this
I do not
question
think that it is correct on my part
That's
to
right.
recommend any specific medication for you, because on a platform like this, it would be unethical. Please consult your doctor. He would be able to guide you best after looking at your various parameters.
And for those of you who do want to consult Dr. Pardiwala, you know that he's at the Wokat Hospital in South Mumbai, and then the numbers are there on the website. You can consult him at all times, and not at all times. You can consult him via the hospital, and then he would
Definitely try and help you.
Doctor, a few more questions. I'm sorry. We have a question from Sudhir Srivastava, who says, I'm 63. I have hypothyroidism and heart disease for more than 20 years. Recently, the angiogram was done and there was no adverse changes over the last 20 years. There are some blocks and I'm on medical management. There are times when I feel a lot of warmth in the upper part of the body, starting from abdomen and extending to chest, throat, and head. It remains for hours together. What is it due to? Cardiologist has said that there's no heart issue.
So probably this is psychosomatic in nature, in the sense that you are a little worried about your disease. If your coronary angiogram is absolutely stable, please relax. There's nothing wrong with you. And this is just something that your brain is conjuring up and giving you a somatic symptom. It's nothing to worry.
You know, doctor, I'm going to, since you mentioned this, and I do understand the need for this, next week we are doing a special session on heart failures. But the session after that, one of the sessions after that, we are going to talk about meditation and how to relax. So
Excellent.
That's a special session we will do. I do know that there are some people over here, Anita Dakshit, who was here a little while back. She has done a few sessions. She is associated with the Art of Living. So whatever form of meditation you can do, please try and do that. One last question, Doctor, from Shrikant Kulkarni, says there are some videos that say that statins can cause diabetes. They're actually meant to control cholesterol. Do you agree?
Statins can cause diabetes in about 5% of the population, occurs more often in women than in men. As I said, I have been in practice for more than 35 to 40 years now, and I've only found 4 patients, 3 women and 1 man, who had a statin-induced diabetes. In all of them, withdrawal of the statins made their diabetes come back to normal. However, in one of them, reintroduction of statins again caused the blood sugar to go up. So those are the statin intolerant patients. They are 1 in a million. But there is no gainsaying the fact that the benefit that you get from the statin far outweighs the risk of developing diabetes.
Thank you very much, Dr. Pardiwala, for being here. I know you got a little late, but you've answered more than 20 odd questions that are there very patiently, and given your own life examples, because you clearly have an exceedingly demanding life, if I wouldn't say stressful. So that itself is an indicator of how things are. And the very fact that you gave out of your own example that, you've been having a blood pressure medicines from age 30. I'm not going to ask you your age now, but you've been having it for many years.
I've been having it for a long time, and the thing is that one should never hide that one has hypertension or diabetes or whatever, right? Because by hiding a fact, you're fooling yourself.
Right.
That is something which is very dangerous. Don't do that. Yeah,
absolutely. Thank you very much, Dr. Pardiwalla, for your session today. There have been a few more questions that have come in. I'm sorry, I'm not going to be able to take all of them today. We will perhaps have you once again, because the interest level in a topic like this are huge, and we should discuss this more often. Thank you once again, Dr. Pardiwalla, and thank you all for being here for this session of Health Live at Seniors Today. We will be back once again next Saturday at 5 p.m. for yet another Health Live. Thank you very much, Dr. Pardiwalla.
Thank you very much, and stay safe and stay well.
Thank you.
Subscribe now and press the bell icon. Never miss an update.